The treatment strategy when we're dealing with condyle to disc issues is mostly to relieve the muscular tension that's occurring within the skull to allow that jaw and that tension within those mechanoreceptors and those nociceptors to start to reduce. So what we're doing here is a lot of mobilization and muscle work to help to free up some of that movement of the jaw. When we're now progressing onto issues that surround or that relate to condyle to fossa issues, this is where we start to needing to make sure that the vertical height of the molars is in the right position, that the head position is not too far forward, so making sure there's no or little or no tension within the cervical spine. Making sure there's proper development of the mouth is very, very important in terms of reducing condyle to fossa type problems. So this is where often a lot of the issues happen in the last phase during closing, where the teeth are starting to want to match up. So often that also occurs when there's a strain pattern within the skull that is causing a distortion or a mismatch between the temporal bones either side. So even though the jaw's opening and closing, where the teeth want to match or meet up is not in the ideal position. So that's what causes the deviation to occur. The problem is like any joint, once you start to affect the mechanics from a midline structure and you start to cause it to move either side, you're putting more stress and strain into the TMJ itself. And finally, the treatment for a fossa to disc issue is now we have to be looking at that click. We have to be looking at to minimize the click, but also to improve the amount of rotation that's actually occurring within the TMJ, especially during that first 25 mils of opening and closing. So this is where things like opening the mouth to 25 mils, close, open, close. Doing that 10 times in the last phase, then you can open it completely to 50 millimeters. Another quick test is how many fingers can they actually fit in the mouth. So what we want to see is ideally 3 fingers breadth of fingers within the mouth, and they should be able to do that comfortably. If you start to notice they're getting clicking during that phase of opening or closing, then really you need to be working with a chiropractor that really knows what they're doing with regards to TMJ problems. And also a dentist that can also stabilize the jaw, because really what you're dealing with is a sprained ligament. So what do you do with a sprained ligament? You try to immobilize it. You try to immobilize it to reduce the inflammation that they're getting. But the problem is that we want to try to rehabilitate that disc so that disc doesn't cause that jaw to be locked, either in a locked open or locked closed position. So really they need rehabilitation, which will take a joint effort from the practitioner working with the jaw as well as the dentist as well. So if we're looking at subjects regarding airway and posture, we know that posture and airway are probably the most important things that we need to look at when we look at the musculoskeletal system. Airway, obviously we can only survive for a few minutes without air, and posture is vital because it sends information to the brain about where the joints are, but it also allows the body to assume an efficient position so that it can function properly. So one of the things that we look for is, are they able to breathe properly? Are they able to nasal breathe? So many people, they breathe through their mouth, but what often happens is they don't develop the nasal breathing, and that really needs to be assessed to make sure that they don't have an airway problem that needs to be looked at, either seeing an ENT or making sure that they don't have swollen adenoids or tonsils that may need to be addressed as well. Being able to allow their head to be able to sit in the right position, which is ideally where their ear is in alignment with their shoulder. When you start to see an ear that's starting to translate forward, then you're starting to deal with a problem that potentially will start to cause neck issues and headaches and all kinds of musculoskeletal issues because of the poor mechanics of where that is. So the goal is, are they able to nasal breathe? Are they able to maintain a good neutral spine as they're breathing? And this is fundamentally the main objective. What we know from the human body is the jaw is one of those joints that have very high position sense receptors. They send a lot of information up into the sensory cortex, and most of those fibers, because it is so sensitive, it is vital that we make sure that the jaw and the teeth are in the right position. Now, not only to allow the stimulus of the jaw to be even on both sides, but also to prevent the jaw, like any other joint in the body, from moving into a state of arthrosis or degenerative problem. So we really need to make sure that the bite position is great, that the jaw is able to move and open and close properly during the normal phases of opening and closing, but also deviation of the jaw left and right, and protrusion as well. So we know that jaw issues, particularly into that structure, can start to have other effects on the body, and sometimes that may include local effects into the neck, local effects in terms of the chest and upper shoulder area, but also can start to have proprioceptive inputs into lower structures, particularly into the pelvis, the ankles, the knees, when you start to have problems with occlusal patterns and how that may actually affect the neurology of the body. So this is where you need to really be working with a body worker that really understands this process of how problems in the jaw can start to actually affect not only local tissue changes, but also distal tissue changes, particularly into the pelvis and into the legs and into the knees. So if you like the information that I've shared, please feel free to comment below. Otherwise, keep following, and thanks again for your time.